Science seminar today on policy implementation science. We are honored to have Dr. Luke Fowler as our guest and our speaker today. Dr. Fowler's presentation is entitled Practices, Interpretations, and the Way Things Are Done, a multiple streams perspective on policy implementation. A little bit about Dr. Fowler. He is a professor of public policy and administration at the School of Public Service at Boise State University. His research interests include policy implementation, collaboration and collective action, energy and environmental policy, and state and local government. Dr. Fowler's latest book is entitled Democratic Policy Implementation in an Ambiguous World. Dr. Fowler is the author of 2 books and more than 4 dozen journal articles appearing in many of the field's top journals, including Policy and Politics, Governance, Public Administration, Policy Studies Journal, Review of Policy Research, Administration and Society, and American Review of Public Administration. Dr. Fowler previously served as faculty director of SPS and the MPA program director. He received his PhD from Mississippi State University. So with that, I'll pass it over to Dr. Fowler. Folks, please save your questions for the end, but also throughout the talk, you can put questions in the Q&A using that little Q&A button at the bottom, and I will keep an eye on those, and they will be fielded at the end. All right, thank you, Dr. Fowler, so much for taking the time to join us, and the floor is yours.
All right, well, thank you for having me here. This is, a great seminar, interesting stuff to talk about. So I think I might be a little different than background-wise than a lot of the people that participate in all of this. I'm not a health policy person. Surprisingly, I know very little about health policy. But my background is political science, public administration, and so what I study in general is how our government works, how we solve public problems. Jonathan said in my bio, collective action, how we coordinate and organize lots of people into groups to do things, and this is essentially what policy implementation is, right? How do we get people to all behave in the way that we want them to do, or to behave, right? And this is, there's so many great examples, right? Like COVID was like one big example of like where we break down in collective action, particularly in America, and how certain societies are better at it. Like it was one of those things where if everybody could just like socially distance for a while, maybe outcomes would have been better, but like not everybody wanted to participate in those. And so there's a series of really interesting questions that go on here. And one thing I really like about the policy implementation literature is historically, like when I say this, like 30s, 40s, people are like, oh wait, implementation is so automatic, it is so simple, it's not worth studying, or it's so complex and it's impossible to study, right? And these are people at the same time arguing this, and both conclusions are like implementation isn't worth studying. But in the 60s, that really changes when people, and there's a book in particular by a guy named Jeffrey Pressman and Aaron Wildowski called Implementation, and it's about economic development policy in Oakland in the 60s. And it really highlights that those programs of the Great Society reforms. I'm not sharing my slides yet. I'll get there in just a second. The Great Society reforms, a lot of those programs weren't as successful as they could be because of the implementation side, right? And so this sets off a lot of people to start thinking about what it means for implementation. And so theoretically, a lot of that stuff drags, but me and some others have started to kind of engage in those theoretical questions to try to explain how implementation works. And so this is where a lot of my work comes in the last decade or so, at least particularly the last 5 or 6 years. And so this will sum up and kind of use an overview of a book and several articles and some other work that has happened in some different places, and kind of lays out a theoretical framework for thinking about policy implementation. So I'll go ahead and share my slides and we'll start digging into this stuff. Hopefully this won't be too boring. All right, can y'all see that? Yes?
Not yet.
Oh, let me try that again. There, all right, can y'all see it now?
Yep. We're good. Yep.
Perfect. There's too many buttons to click. All right, so let's start with what is implementation. And so typically I frame this around the idea of how policies, directives, really any large-scale rules are acted upon at the point of service delivery, right? So this is not about this is not about like what policy says. This is about how actions happen, right? How do we actually deliver service? And so that ends up being really, really important. And the textbook example I always use my students is when it comes to speeding in the highway. And I think probably a lot of you are in New York, so this might not matter as much to you. But in Idaho, like the speed limit on Interstate 84 is 75 miles an hour. You don't get pulled over for going 76 miles an hour. You get pulled over for going 81, 82, right? And so the policy says 75, but in practice, the speed limit is really like 80. As long as you go 80 or below, you don't actually get a ticket. And right, that's the enforcement part. And so that gap between 75 and 80 is really an important part of what the difference between policy and theory and policy and practice is. And that's like a simple example. But we can also think about that really in so many different places of what the policy actually says versus what people actually do. So when it comes to implementation, implementers have to make decisions about how policies fit into the reality of the situation. And for a cop that's looking at speeders, does it really make sense to pull over somebody that's going 76, right? When they have other things to do, right? I mean, there's opportunity cost. Every time you pull over somebody that goes 76, you might miss somebody that's going 90. So you sit back and wait for the people that are actually egregiously violating policy. And so those are the types of questions that we have to think, and I'll talk a little bit more about this in a minute. But the other thing that we have to keep in mind about implementers is that they aren't responsible for implementing one policy. They're responsible for implementing tons of policies, tons of directives all at the same times, right? And I think about my job as a faculty member, right? I have a series of state laws that I have to comply with, and I'll talk some more about some of the examples of that have come out recently with that. I also have university policies, I have program policies, I have college policies, but then I have my professional responsibilities as somebody with a PhD in public administration about what I have to cover in my class. So when I walk into a class, like I have a really complex set of choices to make about what I should and should not say. Idaho has a law now on the books, and again, we did some case studies about this that I'll talk about in a minute, called HB 377 that came out a couple of years ago. They've just updated this law essentially to really restrict how faculty talk about, and it's basically the first ban on critical race theory in the higher education in America. And it makes a fascinating case study in all of implementation because it's not really a ban. It's a very ambiguous law about what it says, and I think it's essentially meaningless. But it layers on top of this. When you look at all your professional responsibilities, and now you have this new law, and the question comes down to, should I talk about race? Should I talk about inequities? Is this against the law or not? What are my professional responsibilities here? And so looking at that really complex, ambiguous situation, what is the right thing to do, right? And that's not easy to understand. And so the research question, as I always pose it when it comes to policy implementation, is the question of how are status quos constructed and deconstructed. So status quos, you might alternatively hear me refer to them as behavioral norms, intuitive thinking, like whatever. Like how is it that we come to do or create our routine in our jobs, right? What are the mechanisms that lead to that? But then what are the mechanisms that allow us to break out of that, right? Because when it comes to policy implementation, we want ultimately to do two things, right? When we pass new policies, we want people to comply with them, which means changing their behaviors. And we want them to continue to comply with them over the long term. But at some point, we're going to pass another policy that undoes that first policy, and we want them to stop that routine that they have and do something new. So these mechanisms are the things that we think about, right? So, the AMA comes out with new directives on how doctors should treat COVID. How do we get them to start doing that instead of what they are doing? Right. And in 10 years, when those directives update because science is advanced, how do we get them to abandon the current way they're doing it and do something new? So these are the things that we're concerned with when it comes to implementation, or at least I am. So what is ambiguity? I'm going to use that term a lot. It's a technical academic term, even though it gets thrown around a lot in kind of like common parlance. But these are a situation is ambiguous when there are competing yet rational ways of thinking about the same phenomenon, right? So this is where you could call it a difference of opinion, but ultimately things that there's not one right, clear answer that we can ever really come to. This is different from uncertainty, right? Because more information does not alleviate ambiguities, right? And so our economic situation right now is uncertain because in 6 months, we will know what our economic situation is. Are tariffs a good or bad thing for our economy? That's actually ambiguous because they're going to have countervailing impacts in different ways. And that is we're going to have more evidence about how those impacts have played out in our economy, but it's still going to be like a point of debate about what is good or what is bad there. So, I give two examples here of possibly ambiguous questions, right? Does democracy improve social outcomes? That's an ambiguous answer. If you look through the literature, some things say yes, it does. Some things say no, it doesn't. Some say it depends on a lot of factors. The relationship between economic progress and democracy is really complex. It's like a chicken and an egg thing. So it's an ambiguous question that's not very clear to an answer. The other thing is that a lot of things are ambiguous, which technically we could get information to solve or answer the question, but it's just unobtainable. Like what killed the dinosaurs, right? The thing is, that is a knowable question or a knowable answer, but it's impossible for us to collect that, right? Because we don't have time machines. We can create, and my son loves dinosaurs, and so this always kind of makes me giggle to think about this. But like there's all these theories, there's all this evidence, but it's also ambiguous because we don't know for sure who dinosaurs were, or I guess what dinosaurs were, like how they operated, how they functioned, why they went away. Like those are all theories, right? They're not necessarily like written in concrete. So that remains an ambiguous situation, right? So again, as we think about policy implementation, what is ambiguous here? Like how do we make choices? In this space where we all can possibly think about things very, very differently. All right, so why does this cause problems? One, practices are not always transparent. So the thing, policy and theory versus policy and practice, right? When we write a policy down on paper, there's a theory of how things should work. And that is the theory. That might not be how it's practiced. And the difference between those two things is really, really important because ultimately the policy and practice is how our government functions. And as some of y'all might have been trickling in, I made a reference to, what the Trump administration is doing right now. They are interpreting policies differently than previous administrations. They are practicing policies as differently than previous administrations. Some of those ways might be legal and some of those ways might be illegal. And we have to wait for that to work through the courts. But the way that they're doing it has very real impact on Americans, right? I mean, there's the case of the guy that got deported to, I guess, El Salvador. They're saying that what they did is legal. The Supreme Court's saying they're not. And now they're debating on what's practicable about bringing him back. That's having very real impacts on people, regardless of what the law says. And so those differences are really, really important. The other part, and I guess, some of the other problems that come here, right, particularly as we think about democracy, is that policy intents may not always align with actions, which means that the way that we practice things may not align with how they are meant to be practiced. And a great example of this is what's called the National Environmental Policy Act of 1970. And really what it requires, or the purpose behind it, was to require any federal agency that made major decisions to consider the environmental impacts behind them. Well, there's a lot of research, really from the 70s and 80s, and it continues on today, that said that after this policy was passed, that NEPA was used as a point of leverage by environmental interest groups. And what they did was just sue federal agencies for violating NEPA. And as a result, federal agencies got really, really good at complying with the letter of the law. What they got very bad at was paying attention to the actual environmental impacts. And so they were really good at practicing what NEPA said you had to do, but they weren't very good at following the intents. And so that ends up, again, being an interesting kind of point of, are our practices grounded in the things that we are trying to achieve here? Or are they just things that we're doing, right? This is where you get the perception of red tape within bureaucracies. Like, I just have to fill out this form because they say it. I have to fill out this form, not because it means anything. Inconsistent implementation also leads to inequities. When practices are not transparent, it almost always disadvantages people that are out groups, right? People that don't have the social connections, they don't really decode situations as well. It almost always negatively impacts them and creates inequities there, right? And so that always ends up being an issue here, right? And in academia, we almost always, and it's something that was talked about forever, was like fit for faculty positions. And that's something that a lot of places have gotten away from because fit is so ambiguous. It was almost always used, or it was operationalized in a way that negatively impact minorities, either women or racial minorities, in ways that wasn't definable or understandable. And so that was always seen as a point of implicit bias. And then finally, it really obscures the pathways of accountability, right? Because when we're not really transparent about what we're doing, it's really, really hard to hold anybody accountable. And so ambiguity really complicates this idea of how do we turn policies into practice. Though I'll say with all this, ambiguity is not like it's not a cancer in the system that we need to try to remove. It is an institutional feature, right? It is impossible to remove from our systems, right? So the challenge here isn't removing it, is coping with it. Is how do we take it and operationalize it, or operationalize our institutions in ways that gets the best out of them, right? There's a lot of PA theory that actually drives me and most of my students crazy. And generally, what would argue is that our government works as long as we have like the poet warrior class of bureaucrats, like the ones that are smart and competent and morally right. And as long as they're running our institutions, everything will be fine. And you're like, well, how do you test for that? How do you know if you're hiring those people? How do you know? And they're like, well, you just have to, I guess, figure it out. And you're like, right, that's a fantastic answer for our constitutional challenges. But again, like understanding like how we put this power in hands of implementers, because ultimately, one thing that this framework gets at is that the power of putting policies into practice, but also really the responsibility of seeing democracy work. And I'm going to talk a lot about democracy. Is that it's in the hands of low-level employees, right? It's your cops, it's your teachers, it's your nurses, it's your doctors, right? Those are the people that have the power of making sure these policies work. It is not, Congress, is not executives at hospitals. It's the people on the ground. And so implementation is a very, very important part of our systems, but also how we govern, how we provide all these outcomes and social services that we care about. All right, so what is the multiple streams framework? So around, I think it was 1991 or so, a guy named John Kingdon wrote a book where he outlines what is like really the first iteration of the multiple streams framework. Since then, it's become like one of the most popular policy theory frameworks for a lot of reasons. One of those is that it can sort of be a theory of anything because it's just vague enough that it can explain a lot. But there's been a lot of people that have worked very hard over the last couple of decades to try to outline it, to get very specific in terms of hypotheses, methodological testing. So it's a lot more than what it was originally, right? To really expand it. And so, but one of the things is it's very simple. And so I'm going to talk about a little bit of the basics of it, how I've applied it to implementation, how it helps us understand the governing process, and then some of the conclusions that we can draw about implementation from it. So key assumptions of the multiple streams framework. First, ambiguity, right? Which I just kind of outlined. There's three sources of ambiguity. The first is probably the most important, is what's called problematic preferences. And simply put, this is that people do not know what they want. It doesn't mean they don't have preferences. It just means that they don't have preferences in a traditional economically rational sense. And so one of the things, like for an economically rational person, we might assume that they know the value between, or their preferences between different choices, right? And so my wife is great about this. If like she's like, oh, go in the store, do you want something to drink? She's like, yes, I'll take a Diet Coke. And if they don't have that, I'll take a Dr. Pepper. If they don't have that, I'll have a Mr. Pibb. And she could tell me like rank order choice of like 8 different drinks, right? Of what they have and might not have. I'm like, hey, give me a Coke. And they're like, well, what if they don't have a Coke? And I'm like, I don't know. Let me just go in and see what they have, and I'll figure it out. I have problematic preferences. And what this references and thinking in a bigger sense is a lot of times people don't know what they want from the beginning of process, and through the act of searching for answers, they learn what their actual preferences are. And so when we think about the public interest, when we think about healthcare policy, when we think about all these things, we have to realize that the average person does not know the marginal utility of any choice. What is the marginal utility between having a socialized healthcare system versus, a capitalist, like one that we have here versus the one that they have in the UK? Well, the average person will say, well, I don't know. Why don't we let me try the one in the UK for a while? Like, well, that's not really how this works, right? Like, what is the marginal utility between different, treatment options for cancer? Well, let me try them and see which one I like the best. Well, that's not really how that works. Like, you kind of have to pick one and pick a pathway here. So that means that we can't really interact or make choices from the offset with understanding that there's necessarily rational basis for all of these things. People have to figure stuff out. The second one is what we call unclear technology, right? And it comes down to that most people don't understand science. They don't understand, unless they're issue area experts, they don't understand how things work, how things happen. A lot of times in organizations, we talk about we don't understand, or people don't understand the organizational process by which things happen. We don't understand the policy process. We're going through P&T reviews right now in my program, in my school. And we always sit and everybody looks around and goes, now, what's the process here again? Like, who's supposed to review this? What are we actually voting on? What forms are, and so nobody really knows what's supposed to happen. And because you don't know what's supposed to happen, there can be a lot of confusion about it. And I think one of the best examples of this was how everybody sort of became an expert on vaccine approvals during COVID. And they're like, oh, yeah, we'll just do it this way. And you're like, well, there's an FDA process here, and it's complex and it's rigorous, and there's reasons why it's complex and rigorous. And we don't just approve vaccines overnight. But that part doesn't compute with people because they're not issue experts. They don't understand how the technology works. They don't understand. And Jesus, all the people that talk about mRNA vaccines like they went to med school, all the people on YouTube, you're like, you don't understand this technology. What you're saying is wrong. I understand how you're getting to the conclusions you are, but you don't understand the technology to get there. And the last part of this is what we'll call fluid participation, which generally refers to the fact that in any decision-making, situation, it sort of depends on who's in the room. Right. And I'll go back to P&T, earlier this week, there was about 9 of us in a room making a decision. Well, I knew all 9 people and they were all in agreement on some things, but the people that were not going to agree with us on certain tenure files actually didn't attend that meeting. And had they been there, those conversations likely would have gone different. And so one way that we can think about this is, how do we define publics? I think one of the really important debates that has gone on in America in the last couple of decades is, are immigrants, illegal or illegal, part of our communities? Do they get to count in these decision processes? Because counting them in our decision processes actually changes a lot of mathematics, or a lot of of how we might define public interest. Y'all live, again, I'm sure a lot of y'all are in New York, but I live in Boise in the Treasure Valley. There's a question of, if you work in Boise, but you live in one of the outside communities, are you still part of the public in Boise, right? Should your preferences be taken into consideration when we decide, on tax rates or on parking or any of those type of things? Are you part of the community or not, right? And so how those are counted shifts a lot of the dynamics here. So that's kind of where ambiguity comes from. The other 2 kind of points here that are kind of important underlying assumptions are, one, are time constraints. I'm sure many of you have heard of the idea of bounded rationality, right? We are only rational within our bounds to have information and process that information, which means we're not supercomputers as individuals. We don't know all the information. We can't predict the future. We can only make decisions in the moment based on what we know. And one of the things I love to tell my students is that every dumb decision I've ever made in my life seemed like a great idea at the time. Every rational decision, every stupid thing that you see, people think are rational and make sense based on their availability of information and what they think is going to happen, right? Even meth heads that run from the cops, they think, oh, I'm going to give it. This is a great idea. And then it never is, right? Because we are constrained in our ability to process things given the time parameters. So one of the things, and when you take the ambiguity part and time constraint part, really what you have to realize is that we have to abandon the assumption that anybody is rational in an economic sense, that they're only rational in their ability to make sense of the information in front of them. And the third thing we're going to call stream independence. What this refers to, and it's really interesting, is the idea that how we interpret problems, how we interpret policies, how we solve problems is not necessarily based on the problem itself. That there are lots of problems, or there's lots of ideas out there that are floating that are just waiting for a problem to solve. And one of the great examples of this is the Iraq War in the Bush administration. There's great evidence to suggest that Donald Rumsfeld just brushed off the plans for invasion from Bush 1's administration. It's like, oh, we have a situation. I'll just bring this idea right back out. And so we see that a lot, right? That there's ideas. Shockingly, Project 2025, everybody acts like those are new ideas. They are not. They're all rehashing of old ideas. Those are ideas that have been floating around in American politics for a long time. They have been floating around in European politics for a long time. I would say, actually, in American politics, I haven't seen a new policy idea in a decade. Most of these things are just old ideas looking for their moment, right, where a problem actually is out there for them. All right. So with that said, there's 5 structural elements here. This is going to get more, I promise my presentation is getting more interesting as I move forward. So there's 5 structural elements. The first 3 of these are the streams, which would go to the multiple streams part of this. The first is politics, what is acceptable based on our prevailing values and beliefs. Policy, which are ideas to solve problems, and problems are non-ideal conditions, right? They're socially constructed. The important part of problems is not to think about problems in any objective sense. They're socially constructed. It's the things that we think ought not be like that in a normative sense, but also have our attention, right? So like one man's trash is another man's treasure. The unemployment rate in one country could be outstanding in their perception, but horrible in the perception of other countries, right? So the problems are not just problems; it's the things that now have our attention, and there's lots of different ways they come to our attention. And then the final two elements are what we're going to call entrepreneurs, and these are actors looking to what we'll call couple the streams and convince others to think in a certain way. And when we talk about coupling the streams, what we really mean is that there are ways that you combine the politics, policy, and problems, which are kind of buckets of information, into what will a cohesive, cogent narrative about what's going on, right? You're like, hey, look, Jonathan, here's a problem, here's a solution that makes sense, and it meets all our community values. Let's put all these together. And Jonathan's like, yeah, that makes sense, right? And that so it's on the entrepreneur to try to convince people to think in certain ways, right? And this is how they convince them, or this is how the policy process largely works. And then we talk about policy windows, which are opportune times for all of this to come together, right? Momentum is an extremely important thing here. And an example of this was when I first moved to Boise. We had this thing called snow apocalypse, and yes, it does snow in Boise, but there was like 2 feet of snow on the ground. All the roads were shut down. People were kind of freaking out. And the mayor of Boise tried to use this moment where everybody's stuck in their houses to complain about the management of the roads system in Boise and his conflict with the county over who controlled the roads and all this type of stuff. And he pushed his advantage, but then he waited about 6 weeks for the state legislature to come back in session to pass the state law. But in 6 weeks, all the snow melted, and so nobody cared anymore. Like it was a problem, but nobody cared. They all lost attention and they moved on to the next thing. When everybody was stuck in their house and they were pissed off about the snow, oh yeah, we could have changed that law. But 6 weeks later, it was gone, right? And so there's these moments where things are happening. Now I'll talk more about that when it comes to implementation in a minute. And so you have to take advantage of this. All right, so this is a nice little chart that outlines this, right? So we have our little 3 streams that are out here floating, right? And then, I'm sorry, these 3 streams are out here floating. And at the right moments, entrepreneurs pull all of these ideas together to try to convince people this is a good idea, right? This is what they should do. And if they do it, we end up with a new output, a policymaking output, which is a new policy. Policy can be a lot of different things, which I'll get to again in a minute. But this is a simple way of thinking about how policy is made. All right, so when we extend this to implementation, which is what I'm sure you all want to hear about, is first we have to understand that interpretation, and here's a couple of assumptions that we have to make from the beginning. One, interpretation or sense making is a prerequisite for any implementation behaviors. That means before you can implement any law, you have to interpret it. You have to make sense of it. There is this law called HB 377, which I referred to earlier. It is a ban on critical race theory in Idaho. Before anybody, like when this law got passed, like all faculty were like, oh my God, what do I do about this? What does this mean? Like, how does this affect me? It was this thing where everybody was very confused about what they were supposed to do, because you can't really implement a law like that positively or negatively without understanding what it means. And so it was this really intense series of conversation that people to try to collectively sense make around this. And again, as I mentioned earlier, implementers are not just responsible for one policy. It's actually a layered series of policies, right? So it's lots of different things. 2, the action arena for decision making really shifts from collective choice to collective action, right? It's not a discrete group of actors, say in a legislature, that are trying to make a joint decision about common goals, right? It is indiscrete actors working interdependently to achieve a common goal. And so indiscrete means that, like, I can't actually tell you everybody that's listed that is responsible for implementing HB 377. I can tell you everybody in the state legislature that passed that law and voted for it. I can't tell you everybody because it is an indiscrete group. It is everybody that possibly interacts with these ideas and interacts with students are now responsible for doing it. And they have some responsibility, either small or large, and they're working interdependently to achieve a common goal. Even if that common goal is stupid, they are all working interdependently. That makes implementation a really like murky thing, because we can't really in most places outline all the people that are responsible for stuff, right? And again, let's go back to COVID, mask mandates, right? Who is an implementer with mask mandates? Really everybody, like every living person on it, but that's not like a discrete group, right? It's everybody in different contexts. And then we have enforcers and people are trying to manage compliance, but it gets really, really murky about who's responsible for these things. Implementers are subject to manipulation in the same way that policymakers are, right? So that building of that cogent narrative. In other words, like we can convince people to think certain ways. And if we do that well, we can get them to behave certain ways. However, bureaucrats value the status quo, the way things are done. This is the most powerful logic inside of any organization. The way that people do things are the way that they're always going to do things because it carries very little risk to them. When you do things the way that you've always done them, you know exactly what's going to happen. When you do things differently, there is risk. And I don't know what Dr. Pirtle's experience of this was, but when I started teaching classes, I was like 22, and they're like, "Here, you're just going to teach a class," and they just kind of pushed me in the room, and I was like, "Oh shit, what am I going to do?" And I just sort of figured it out. And now, looking, almost 15 years later of still teaching classes, I sort of do the things that I've always done, that I've learned, do not get me yelled at by students or my boss. Right? There's a needle here, right? These are the things that I can get away with in this space. And those are the things. And so when you're like, "Hey, why don't you try something innovative in the classroom?" I'm like, but if I try that, what if students don't like it? And then they yell at me? Or what if my boss, what I mean? Like, what if I do something different? Like, what are the risks to me that requires me to do a lot of thinking and a lot of planning and a lot of work? And that's not cool because people don't like to think, they don't like to work. Why would I do something different when I know what I'm doing works well enough? Right? So bureaucrats and really just people in general like status quo. They like their routines. They're simple, they're easy. And then finally, part of this is the policy adoption and implementation are not interdependent. That's why I talked about that part about policy making earlier, because these things are not separate. The things that happen during a policy adoption processes impact implementation. And a really important part of this was, again, when we talked about HB 377, and I've seen it in a couple of other places, which is the problem framing around indoctrination for students. That worked to pass a policy, but it absolutely fell flat when it got to implementers. When it got to university faculty, when it got to teachers that were like, "Well, I'm not currently indoctrinating students, so I don't have to comply with this law that tells me not to indoctrinate students." And so there was no action because ultimately a lot of people felt like the law was meaningless based on how it was framed as a problem solver. And so these things are not independent of each other, and that needs to be understood. All right, here's really the same sort of model, right, of these streams, right? Problem streams, policymakers identify the problems early on that we know what we're working towards. The politics, we have a good sense of what, from the political dynamics that go through the policy process, we have a good sense of what the balance of interest are, what communities think are acceptable. We also have to layer in here a certain amount of organizational politics. The people that you work with, they want different things. You're going to have to play those games to try to think about how you speak to different interests there. And then there's the policy stream, which in this case is actually competing interpretations of policies, right? Competing interpretations of how we might do our job, right? And so if we do it well, and I think about myself as a manager and particularly as this entrepreneur, right? If I want to convince my faculty to do something different, I'm like, here's a problem, and here's an idea about how you might solve that problem by changing your behaviors, right? And if I wrap this story together well and tell it to you well, you will rethink your job and start behaving different, right? And so that's sort of what happens. And this output here are our new behavioral norms, right? And so this is a broader model that tries to connect all of these things together. And really what this adds to it is once we get past outputs, we get what we call policy process outputs. These are the broader social changes that we're looking for, right? So like with a health policy, like we want a healthier America. We pass a new policy, that policy gets interpreted and acted on. Those actions become behavioral norms. It changes the health of our communities, but then the health of our communities feeds back into what we define as problems in the future, right? And so there's this cyclical nature that goes on here. And I just want to give you a broader perspective of how all this is tied together. All right, so back to implementation. There's 3 levels of analysis here that I think are really important and which differentiates it from some other things. One is the micro level, which is understanding the cognitive processes, right? This is the sense making, and there's a lot of information stuff from information science, neurosciences, psychologists that talks about sense making. This is how individuals interpret policies. This is how they analyze information. There's these things called system 1 and system 2 thinking. System 1 is intuitive thinking. When we talk about status quos, when we talk about routines, this is intuitive decision making. It is the things that we don't have to think about. Often, I mean, I've read in a couple of different places, ER docs are particularly trained to 24-hour shifts and stuff, so their brains shut down, so everything they do is intuitive thinking, and that is a part of training deliberately, so they don't think about their choices. They're on autopilot, right? We do the same thing in the military. with soldiers. We want their brains to shut down so they're not actually thinking, that everything is just intuitive, right? That works to our advantage as an organization, because if you are doing everything intuitively based on what your manager wants you to do and you're not thinking, all your behaviors are very, very predictable. They're very predictable, which means we know everything that you're going to do. System 2 thinking is deliberative, right? It requires you to engage in a more complex analysis process of the information in front of you, right? Of the ambiguity. You're like, these things happen. Where system 2 is both a positive and a negative here is that system 2 is a way that we can innovate. It opens the door to innovation. It opens the door to better matching policies to the things that happen on the ground. But all the horrible things that ever happen are also by people thinking. And that's all the dumb shit that you see people do. They're like, well, I thought this and this and this. They're like, well, that was your problem that you thought. You should not have thought, right? You should have just done what you were told. That's a challenge because we want to balance those things out, right? And so the question is, how do we balance this intuitive people not thinking with them thinking, but not thinking dumb things, right? And so again, this goes back to how we make sense of stuff, but the cognitive processes that underlie that. Above that, there's a meta level, which is really a series of social interactions, right? How interpretations are influenced by others. So a reference here is sense givers, right? How other people or entrepreneurs, how other people manipulate the way you're thinking. If you're ever like, I'm confused about this, I want to talk to a colleague, and you talk to your colleague and they convince you to think a certain way, they're a sense giver, right? You got to talk to your manager, like, what does this policy mean? They tell you, you're like, they're a sense giver, right? So it's not just your process. There's also a social engagement part of all of this that helps convince you of things. And then there's really the other part of this is institutions, right? Which we call institutional rational choice. And I label this as processes and functions. But it's the things that we figure out as we work through, right? Part of it is about following rules, but also is making those rules functional. In general, people do not like to be scrutinized. We don't like to be critiqued, and we don't like to be in conflict. So, when we're following rules and people are like, this process is dumb, you're like, this process is dumb. Will I get more trouble if I change the process or if I just continue to do the process, right? How do I make this process functional so I don't get yelled at today? And I've seen that in a bunch of different places, right? How do we balance these processes and these functions from all the different competing things, right? So micro is how we make decisions in our brain. The meso is in these social level interactions. Once we've made those choices, how do the different pressures that we're facing then shape the way that we're making choices? And then there's the system macro level, right? Which is how does all of this come together to create systematic behavioral changes? Problems that are, almost every policy problem that we talk about is human created, or the way that we talk about it is the human contribution to that. Like even climate change, like it is a human contribution to a natural process, like health policy, like there's a human contribution to these things. So how do we systematically change our human behaviors to change the dynamics of that, or the parameters of that problem, right? We have to do that at large scales for it to be effective. And so ideally, all of these things sort of add up to create a level of change, right? And I've actually have evidence of this, which again, I'm not going to get deep into methods here, but looking at the implementation of environmental policy at the state level. And one thing that we found was at certain opportune moments where environmental interests in states become very, very high level, it's combined with an increasing pollution problem, and it's combined with a large investment from the state, like increased budgets. You see this systematic change that happens really relatively quickly over a couple of years in the level of pollution that comes out of those states, right? And so you do see this systematic change, right? At a theoretical level, this is because compliance managers, environmental inspectors, compliance managers, they are now doing their jobs differently than what they were before, right? They've gotten the message that they have to change because everybody's very, very interested in what they're doing, and they're in an intense amount of scrutiny. This new idea of how they're supposed to do their jobs out there, and so it's been forced on them. They're acting differently, results are different, right? And so there's this sort of systematic change that goes through. All right, that was the basics of all of these things. I want to get maybe to a couple of like lessons that we can pull out of this. And I still want to try to leave time, so I'm gonna go through this kind of quick. One, which I always kind of hit on, is ambiguity permanence policy, and it is the key challenge for implementation, right? How do we cope with ambiguity? How do we cope with a bunch of different ways of thinking? How do people look at their jobs and go, I can do this or that or this? How do we do that in a way that makes sense? Two, implementation is a balancing act between new policies being responsive and maintaining status quo, right? So how do we respond to the changing dynamics of things, but not blow up everything that we've built. And again, the Trump administration is a great example of this. There's a certain want to be responsive to the political dynamics of new leadership, but at the same time, some of the things that he's pushing suggest that we're going to blow up our democratic institutions really as a whole. Like, how do we balance those two things? Or do we just abandon one in hopes of safeguarding the other? How meaning is ascribed to policy drives action, right? Which means, like, when you act on something, when you do something, you have to understand what your goal is in doing it, right? That's a key part of sense making. So how we come to understand the meaning and intents behind policy drives how we ultimately our behaviors. And so shaping the meanings and how we infer that ends up being a really important part of a policy implementation. Macro level change starts at a micro level. I already kind of talked about that. It starts out with how people think, and then it aggregates up to collective action. Implementers are an indiscrete group. I think that's a really important part here, because I think a lot of people think implementers are like 5 or 6 people or whatever, but it's actually everybody that comes to touch that policy. And so it's important to think about all the different people that have responsibilities related to a policy and how that affects ultimately the output. Intuition and organization reinforce status quos. That's, our system one thinking, but also the way that we've created organizations to suggest rational choices. They reinforce this idea that the way things are done are the way things are done, right? It's very hard to break out of that. But changing behaviors requires triggering deliberate thinking, which means that we have to, one of the strategies here is to show people that they've made errors, to put them under intense scrutiny so they go back and go, look, this isn't working. I can't continue to do things. And as a colleague of mine always says, like, people only change when it becomes so uncomfortable that they have to change. And so when people are stuck in this kind of routine that looks like red tape, if it becomes so uncomfortable for them to continue, they will change, right? Sometimes that change is good, sometimes that change is bad. Managers are responsible for organizing this anarchy. The managerial role in implementation is extremely important. They are sense givers. They are adding structure to all of this, structure in the way that we think about organizations and processes, but also structure in the way that people are thinking about their jobs, goal ambiguity, their responsibilities, how they're making sense of everything around them, including politics, right? There's lots of this stuff. Again, for the world of higher ed has kind of gotten blown up in the last 3 months. And we have these meetings with the dean, and she's like, look, these are ways that you can think about the politics out there. You're all seeing the news, but you have to make sense of these steps. So she's doing a good job as a manager trying to give sense to everybody else so they can do their jobs in this environment. And so, that there's a lot of skill tied up in the ability to lead through ambiguity, right? And then finally, process building and making policies functional, so go hand in hand. And I didn't really get into a lot of this. It is a part of the book, and I dedicated a chapter to it. But the idea that, this is what separates red tape, right, is us being able to take these processes and make them functional, to take things and make sure that they make sense given the changing dynamics and kind of the changing dynamics, the changing problem parameters and stuff that goes on there, to make sure that organizations continue to be functional, that are in interesting ways. And, again, I've done a lot of research on the faculty dynamics here around like the critical race theory bands. And it's very interesting to see the functional issues there for faculty who are caught between a legislature that's passing laws that says, don't talk about race, don't talk about, all of these injustices and inequities in our society, and students that are saying, hey, I want to learn more about this, right? And so they're stuck between these two things, and they're like, oh God, what do I comply with the law as written, or do I make up a version of this law in my head that allows me to tell my students what they need to hear, or what they're demanding to hear, right? And so they're getting caught between this. I imagine the same thing was probably true for a lot of doctors during the COVID pandemic, where they're getting caught between guidance from AMA and, really their state departments of health, and, well, patients that are spending too much time on YouTube or Facebook. They're like, well, you can't get and so getting caught between this thing where they're like, well, this is the proper treatment. This patient doesn't want to take this treatment. How do I thread the needle and do something that serves them and keeps them healthy and preserves their health? How do I do my responsibilities knowing that I'm caught in this really tricky situation, right? And so those are some of the dynamics that are really important here. All right, so what? How does any of this help us understand implementation? There's a lot of research there that puts the focus on implementation at the organizational level. This shifts that. It looks at the point of interest in implementation on interpretation as a behavioral driver, right? Organization's part of that, but it really focuses on the individual, on the behavior of them, how it is grounded in both social processes and their cognitive thinking. and how we shape that behavior. It also says that, managing ambiguity is the key challenge, right? And so as we think about how do we implement policies better, why are these conditions ambiguous? What leads to them? How do we provide the tools to our, practitioners out there to do better? Implementation and governance, and I think this is a really important part of this. And it's the thing that I wish I could put on big billboards around state legislatures and stuff. It says policy does not solve problems. Implementation does. In other words, passing new laws does not solve any social problem that we care about. It is how we turn those policies into actions that solves our problem. That is extremely important. Passing no law is a silver bullet for anything. It does not mean that problems go away. If it was, then the Civil Rights Act of 1964 would have eliminated racism, but that didn't happen, right? We're still struggling with it decades later. So there is a thing here about how do we turn these into actions? And this was really the solution of the things, and really talking about much of the broader troubles that we have with society today. It's not about coming up with better ideas. It is about turning those ideas into actions. And this is really important, and what a lot of this work gets at. And finally, just to talk about some of the research challenges here. I know I didn't go much into the methodology, but one, modeling ambiguity is really, really hard. It is hard to model, particularly quantitatively, how people are thinking, how they're dealing with ambiguous situations, the different complex pressures that they're coming into. That is a very hard thing to model. Some of the best work on this so far has been done in case studies, because the case studies are able to I've written a couple of them where we're able to interview people and get them to describe just how overwhelmed they feel in certain moments, and how they're coming at and how they're making choices in those moments, right? They're like, all this stuff's going on, so I just sort of turn off my brain and do what the form tells me to. Those type of moments really gives you something that you can be like, I understand what's going on here now. But modeling ambiguity is very hard, and that's a challenge here. The other thing is timing and momentum are a really important factor. One of the things that came out of that the case study on the implementation of the critical race theory ban was that got passed in late May, mid-May, and it was basically when the spring semester was over, and it wasn't going to be implemented essentially until fall. Well, the indoctrination stuff in 2020, 21, once this going on, was a big deal. But by the time that the fall semester started, everybody had sort of moved on, and so it wasn't big in the news anymore. And so I always wonder, had things played out differently, had we gone immediately from passing that law to faculty having to implement it the next day. But instead, everybody sort of lost attention and moved on, and so the momentum died out. And so I used the snowpocalypse example earlier, but we see this in a lot of places. Timing and momentum is an important aspect here. And so it's really hard to look retrospectively at bills when they pass and go back and go, oh, how did implementers change their thinking in these moments when there's an extraordinary amount of pressure on them? There's a time constraint, all of this, right? You sort of have to catch it in the moment, like it's lightning in a bottle, right? You have to catch it in the moment to realize what's going on. And so these are some of the research challenges and why a lot of this is hard to cover. So that is 6 or 8 years worth of research that I just covered in 50 minutes. I know I went through that very, very quickly, and so I'm really happy to answer any questions either here, or if you want to email me or contact me later, I'm happy to answer questions over email or chat with anybody that's got additional questions. And so I'm going to stop sharing, and we'll do Q&A for a while.
Awesome. Thank you so much, Luke. That was great. I learned a ton of ideas. Yeah, folks have questions, put them in the Q&A. I've got some questions. Karina and Donna shared questions as well. So where to start? So I guess one burning question for me, a lot of burning questions, but I'd like to hear your thoughts about kind of motivation and what motivates policy implementers. And I guess to just kind of take a step back, I really liked your slide where you talked about the micro, the meso, and the macro, right? And the micro really matters. And I think at least in health policy, how we think about things, we're all about the macro. We're we need to pass better policies, and it's going to be the silver bullet. I think it's often how we kind of think about it, let alone kind of the administrative processes of administration. And we never really think about the micro, what's driving the implementers and their cognition. And yeah, so your thought is motivation, what drives, decisions about policy implementation and interpretations of ambiguous situations among implementers. And I guess kind of a follow-up part 2 of that is I assume there's heterogeneity. People are different, right? So like the same people, two people working in similar roles in the same organization, implementing the same policy might be motivated to do things differently for a whole host of individual personal reasons. Yeah, so I guess more about that motivation and just those really micro elements of like policy implementation decisions and what's going on in people's heads and what's driving them.
Yeah. So one of the things that's hard about this conversation, Jonathan, in general, is that like there's so many points here where there's entire literature reviews that I could follow and do hour-long presentations. You know what I mean?
Yeah.
And so motivation is one of those that I couldn't dig in deeper. There's a lot of stuff in public administration about like role theory, the sense of entrepreneurship versus the public service mentality and all this type of or a conservator. Like, do we conserve our institutions and protect them? Do we try to reinvent them to make them more sustainable? There's a lot of debate back in there forth. What my experience tells me is that most people that end up in public service based roles do so because they care about something bigger. There's this thing called public service motivation, and I think a lot of doctors and nurses also have it, right? They care about helping people. But what also tell me as I get deeper into my profession, and I know, all our old curmudgeonly faculty, working in institutions and serving the public wears you out over time. Right. And so as much as when you're kind of a young gun right out of school and you're like, God, I'm going to change the world. After a while, you're just like, I just don't want to deal with any dumb shit today. I just want to do my job and sort of be left alone. And so there's an interesting balance there between, this kind of motivation and how people just kind of get worn out by their institutions. But I think you're right. And so it's hard to speak like there's just a lot of differences. There's a lot of heterogeneity that goes on. And I think this is where the role of ambiguity, but also management ends up being a really important part of this. And so as a manager of faculty, what I realized was like a lot of my faculty have different things that they care about, right? And if you learn to speak to those things, you can convince them of a lot of different, right? And there's like a spectrum here, like being completely altruistic to being kind of completely like self-serving. And so like some faculty are like, look, if you do this for me, I will give you all the class times that you want. And other faculty like, do this for me because it means something to our students, right? And so as a manager, and that's one of the reasons, and again, I didn't get a chance to talk or dig in deep there, but like the managerial component of this is really important because if managers learn their people, they learn to know what like pressure points to talk to that matter when it comes to like engaging their deliberative thinking, right? And how they're motivated and what means something to them. And so that ends up being a really important part. And it's one of those fuzzy things that we miss when it comes to policy development and in organization is like the mid-level, how people actually function, right? Because we're not robots, we're not automatons. Like we want to do things and we think things differently. And so that has to be like somehow worked into our models to capture.
Oh, that's great. So question related to something Karina asked. So about enforcement. So I'm just curious for your thoughts on like kind of the notion of policy enforcers. Like, is policy enforcement part and parcel of policy implementation? Is it kind of the same thing, reparsing words when we're talking about enforcement, or is enforcement when roles related enforcement are clearly defined, perhaps in terms of like what police do, right? Where it's more perhaps arguably more clearly written down. Should we be thinking about enforcement differently than implementation, or is it kind of just all part of the same bucket? Is there something written down and now we're taking action in the spirit of that?
I think it's part of the same bucket, right? And it just sort of depends. And so again, let's talk about mask mandates, right? And again, this is one of the things that comes to mind, right? Who are the implementers there? There's a couple of different functions, right? You have police or city officials, whoever that are the enforcers, but really the implementers are individuals, right? Like you're implementing putting your mask on. And so, but somebody ultimately, like without the enforcement component, compliance with that mask changes, right? And so those things are interrelated. And so the implementation, it's a lot. That's why I describe them as an indiscrete group, right? There's not one way to define who they are. When we're talking about implementation, it's really compliance with the policy across everybody that it touches. Now, one of the interesting things, particularly about the COVID part, is, there's this thing, there's research out there, and we found it. We did a case study in Idaho that looked at some of this, which was like a lot of people were in favor of a mask mandate as long as it wasn't enforced, which seems kind of ironic. But there was this thing, I believe it's control aversion is what they called it, which is a lot of people are like, hey, I'm totally cool with doing this pro-social behavior until the government tells me I have to. And then, I'm not doing this. I'm going to fight you in the street over it. Right. And so there was a needle to thread there about asking people to implement versus how we enforce it and how we encourage them to do it. And so there's a lot of different tools there about how we engage. But ultimately, the question is, who is touching this policy, right? And anybody that touches it is an implementer, either 1% or 99%, right? And so it's sort of across this spectrum of things. And it's, again, one of those things that makes implementation hard to wrap your head around, because it's not like a legislature where we're like, oh, there's 100 seats here. It is, when we're talking about public education and implementing some law, it is every teacher, every school official, but also civil or social workers, it's parents, it is students. They're all implementers in some way, shape, or form. And so somehow we have to think about all of them at the same time.
Awesome. Thank you so much. And a lot of great questions rolling in. I think we just have time for one more question. So I'm going to go with a question from Pakistan, global in nature. How do you think about global policy in all of this and global policy implementation? And is that something people are thinking about? Is that just like more macro, or is that like super macro when we're talking about WHO or, monetary policy, things like that? Any thoughts on that that you have thought about or others in the field have thought about in policy implementation and the global space?
Yeah, no, there's not a lot of work around there. That's a great question. And I'll say, for anybody else who has questions, feel free to email me. I'm happy to chat about this stuff and, open a connection up with you. And I'll actually put my email in the chat box real quick for everybody. So on the global level, what is interesting is I talk about policies in general, but policy come from a lot of different places, right? And so in a very conventional sense, because I'm a state politics guy, I think about the state legislature passing something and then faculty doing it. But policy can come from a lot of different senses. It can come from cities. It can come from the American Medical Association. It could also come from, the World Health Organization. These are all different policy avenues. The question is, which ones end up motivating us and triggering those behavioral changes, right? And so if you're a doctor, the AMA says, here's the new guidance. How likely are you to respond to that? Versus if the state health department says, here's the new guidance. Like, which one of those are you more likely to respond to? What the World Health Organization does it? But also, what happens when those three groups tell you three different things? Which is, again, I would say in some states, when it came to COVID, the doctors were getting contradictory guidance from their state public health officials. They're getting contradictory from their organizations, from the national level medical associations, and then some even from the internet. So what are these things that you're looking at? Like, what are the ones that actually affect my behavior? Because when we talk about implementation, the focus isn't necessarily on the policy, it's on the behavior, right? So what is the source that changes our behaviors? And so that's an interesting question, right? How often do doctors listen to who, right? What is the thing that is most likely to drive their behaviors and affect those behaviors? Because certainly as you point out, right, if you want to get those macro level silver bullet laws that change behaviors, maybe those don't come from Congress. Maybe those all have to happen with the state health departments, right? Because maybe doctors don't give a shit what Congress say. Maybe they're only concerned about these things. And so there's this sort of sense of legitimacy in who actually has the authority to shape the way. And that's, again, not a one size fits all thing, right? It just sort of depends on who is talking and who you're talking to. And so these are the things, and I know those are God help me, those are ambiguous answers to your questions. But I think that's sort of the cornerstone of this thing, right? Is that implementation isn't cut and dry. I can't draw a little formula map on the board to outline it. What you have to take into consideration is there's a bunch of different ways to think. I mean, we need to focus on how we shape the way that people are thinking, because that's how it drives action, right? So how do we manipulate their behavior at a micro level? But how do we do it through, the stuff up here? How do we do it on a mass scale, wholesale manipulation of behaviors?
Awesome. Thank you so much, Luke. That was fantastic, as always. Thank you for being gracious and offering up your email for people to reach out to you. And thank you again for joining us. Thank you, everyone, for attending. This was great.
Thank you for having me. Like I said, please reach out if you have any questions. It was great. Thank you.
All right, cool. Thanks. Bye-bye.